The extension of activities to, the orphan care facilities again was less planned by either the SM Galaxy team or me or even the other teams that I've been involved with. It started off with one of the students at UC Berkeley, Anna Key, who became aware, of course, of my, she, was a soccer player, a goalkeeper for the UC Berkeley women's soccer team, and she became aware of my involvement with the youth, through using soccer, etc. in Malawi. But she was studying peace and conflict studies, and she approached me about wanting to meet some of these youth that I work, that I've been assisting, but also wanted to be able to volunteer her services at an orphan care facility. So I told her that, okay, I hadn't really done any work with, orphan care programs, but, fairly typical, I appealed to, SM Galaxy, outfit to facilitate that, and they did. So they identified, the orphanage, at, on the outskirts of Blantyre City at an area called Lirangwe, and the orphanage is called Amayi Achifundo, and so they got that to host Anna. And Anna Key traveled to Malawi in 2005, and was hosted by the same Galaxy, and they took her to Amayi Achifundo, and she stayed, there for a couple of days, and that visit, changed, her complacency, or at least I shook her complacency about the kinds of difficulties that really, reside off the shores of the United States. And so, when she returned, she decided to help that, Amayi Achifundo orphanage. And because of the fact that, she was introduced there through the SM Galaxy team has found itself now, as it were, becoming part of the kinds of, activities and, and assistance, to be, given to that orphanage. But then through that, it's sort of, started suffusing the whole program with, this extra attention, not just to the senior citizens, but now also to, the orphans. Now, whilst of course, it may not necessarily be entirely integrated into the activities of what I'm doing, I would still like to encourage the teams that, that get assistance, whether it's Chalunda Earthquakes in Lilongwe, SM Galaxy said I'm doing that already, and other teams that, might get, in the forward to say, whenever possible, do work, be of service to orphan care facilities in whatever ways, you can be of service, just like you are helping, your areas, like you are helping the elderly, our grandparents, so that at least, we begin to have a more holistic view, focus, on what the society or the country really needs. The resources are stretched, and now, when I left Malawi, and there was probably 1 or 2 orphanages in the country. Now it's almost like what I mean by that, it became an industry that, in the aftermath of, after I left, and over the past years, there's been such an increase in the number of children who have found themselves orphaned. And that's, largely because of, the AIDS pandemic. So the AIDS pandemic, amongst other things, has really, decimated that, so that now you're getting, a lot of children who are orphans. And so that now the idea of having children looked after because they have no parents, has become more widespread. And that's what I mean that say that it has become almost like an industry.
Right.
You know,